Hey everyone, my name is Matt Shea, and I am going to discuss stroke care in the rural setting, challenges, strategies, and solutions. Stroke plays a major role in the healthcare world as it is one of the leading causes of death and disability worldwide. In 2021 and 2022, stroke was the fifth leading cause of death in the United States, accounting for about 5% of all mortalities. Rural areas are at a significant disadvantage in providing timely and effective care. Reasons for this include geographical location or lack of resources and access to specialties or other life-saving high-end care. Addressing these challenges is very important in reducing the mortalities of the rural stroke patient, along with lessening the potential to have life-altering severe deficits long term. So, as we know, there are two types of stroke that we deal with, ischemic and hemorrhagic. One of the most important things is early detection and intervention. Key pieces of this successful stroke care include EMS, emergency response, acute care while the patient is in the hospital, and then rehabilitation to help regain some of those functions the patient may have lost after their stroke. So we're going to start with the ischemic stroke. This occurs when there's a blockage in the blood flow to the brain, which obviously means the brain cannot get vital nutrients along with oxygen. Ischemic strokes account for about 87% of all strokes. Risk factors include things such as hypertension, atrial fibrillation, hyperlipidemia, diabetes, smoking. Very common presenting symptoms include numbness or weakness, specifically on one side. Ataxia, so trouble with your balance and moving, vertigo, like your room is spinning. Aphasia, whether it be expressive or receptive aphasia. Expressive meaning you can't really form the words you want to say, and expressive aphasia meaning you can't really understand what people are trying to say to you. And then also vision changes that we see a lot in posterior strokes, such as ones that affect the occipital lobe. Treatment options for ischemic stroke include thrombolytics such as TPA or TNCase, mechanical intervention, so clot retrieval also is what it's called, along with anticoagulant and antiplatelet therapies. Hemorrhagic stroke, on the other hand, occurs when blood vessels rupture in or around the brain. These will be defined as intracranial or subarachnoid. Risk factors include hypertension, aneurysms, arterial venal malformations, anticoagulation use, drug use, especially amphetamines and things like cocaine, and along with traumatic head injuries. These do account for about 13% of all strokes. Symptoms include sudden severe headache, also called thunderclap headaches. They come on very severe and they are at peak intensity immediately. Nausea, vomiting, altered mental status, weakness, especially on one side, along with seizures. Treatments usually include surgical intervention, medications such as clotting medications, along with emergency care like head to 30 degrees to help lessen that intracranial pressure, and then managing blood pressure. So one of the biggest issues that you see in the rural setting in regards to stroke care is limited access to specialists such as your neurologists, your neurosurgeons, along with those larger and more capable facilities being in a closer vicinity. Longer transport times, which also relates to that geographical location. There's not really as much education about stroke symptoms or prevention in these communities. And then EMS is not usually well equipped or trained in stroke care. A lot of these EMSs in these smaller areas are actually volunteers. They don't really have much medical training besides the basic EMS class they take in order to run the rigs. So EMS is a vital component of successful stroke care because they are the first people to see the patient, meaning that they will be the first ones to be able to differentiate if the patient's having a stroke or something else. So these big barriers, geographical location is a pretty big one. Usually they're further away from your higher end stroke centers. Delays in treatment due to these distances. And then a big thing with that is time is brain. Time is very important. So being further away from these facilities usually means that there is a higher likelihood that there is a worse outcome for these stroke patients. Healthcare workforce, the big one here is the workforce pool is limited. There's less available staff, and then even more so less available staff that is trained in stroke care specifically. Technology gaps, a lot of these rural centers do not have access to those more specialized imaging like your CT angios, your MR angios, or your CT perfusion scans. Many rural centers also have limited access to telemedicine, which hopefully we are starting to get a little bit better at as years go by. And another big one is public awareness. People who don't really understand or know the signs and symptoms of stroke, how important it is to be seen quickly. So here, the biggest things on how to improve care for these rural stroke centers. As I was kind of saying earlier, telemedicine hopefully starts getting incorporated more. It's becoming more available to a lot of these areas. It's such a big part just because you have direct access to these specialists such as your neurologists, your neurosurgeons, neurointensivists, things of that nature. It really helps bridge that gap of stroke care in rural facilities, and really can help facilitate transfers quicker to a higher level of care just because the experts know how to diagnose and understand the symptoms they're seeing and whether or not a patient needs to be seen or not by a higher level of care. Training and education events for the public. I know when I'm at Spine Regional, we do 2 education events a year, mostly geared towards seniors. And we do a lot of teaching, take blood pressures, and we do a lot of overall education on what to look for, how important it is to be seen, things like that. And it really does help kind of get the community to understand how important from the time you see the symptoms to the time you get treated is. It needs to be as quick as possible. And then improve EMS responses. So we have an agreement, not really an agreement, but an education plan with our local fire department. We use the Cincinnati stroke scale. It is mainly to rule out your large vessel occlusions, but it's pretty nice to have just because they can use that tool to help them determine if this is what's really going on or if they have severe deficits at this time. And then understanding that we need to, once you get those symptoms and understand it, you need to get them to the hospital as quick as possible so we can evaluate and decide if this patient needs a high level of care or not. As I've been saying, community engagement is just such an important part of overall community outcomes in terms of strokes. So having people in the community who understand and know and are educated on that, those signs and symptoms, it really helps them, think about getting to the hospital quicker. And as I've been saying, time equals brain. So the longer you wait, the more likely it is you're going to have a severe deficit. The quicker you get treated, the less likely it is that you're going to get a long-term severe deficit. So I think it is very important to make sure that community members are engaged and have been educated. Policy implementation is also a big one. So when I'm writing my policies for my hospital, it's very important that I am following best practice. Peer-reviewed studies are showing me kind of the steps to take, whether it be a policy for stroke activation based on the most common symptoms, or whether it be, just clearly defining if you have a stroke team, those stroke team rules and roles and kind of where everyone fits in that alert process. Having clear defined roles is very important in the betterment of the patient and each different denomination working together properly. And then integrating AI. I think this one is pretty important, especially for your rural stroke centers, just because they don't have access to a lot. Over at my facility, we use an imaging AI called Rapid AI. And basically what it is you get this imagery. The Rapid AI program will run through it. I get alerts into my phone, and it can kind of tell you if there is a large vessel occlusion or if there's a hemorrhage or whatever it may be pretty quickly. It is very sensitive, and I'm not going to say it's perfect because it's just not yet. But part of working with AI and having these things is they're constantly going to get better, and every single image that they read, it automatically is getting better and making this database even more accurate. So it's something I like quite a bit. And with those rural centers, again, not having access to a lot of the specialists, I think this could help them a lot, at least narrow down who needs to be transferred and who doesn't. So really, in conclusion, the rural healthcare it's just a very difficult area just because you're almost alone on an island. You're not around major facilities, and you don't really have access to a lot of these technologies that larger facilities use. But thankfully, a lot of these issues have viable solutions. So with like the imagery stuff, even though you can't do higher end, you can still, put Rapid AI in and see if there are any hypodense areas in a CT that may warrant further evaluation by a higher center. And then really the innovation and investment is just really, really important for the future of these facilities. So investing in true stroke care, having a stroke program, getting policies implemented, having a response team, EMS getting educated. It's just, I think those are some of the most important aspects of really getting the best care to these rural centers. So this is something I'm quite passionate about, being a stroke program coordinator. This is something that I would love to be able to help other facilities with. I'm in contact with smaller facilities around Salina quite often, asking me questions, whatever it may be. So it's been really cool to see some of these programs developed that I've helped put in different policies or whatever it may be that they need. It's been pretty awesome. So hope you guys enjoyed it.